Time is coming up to 18 minutes past 8. Doctors are calling for better access to mental health support so they don't suffer in silence after a study found that the profession is at a higher risk of suicide compared with the general population.
Female physicians are at even greater risk. This is according to the British Medical Journal. Tell us more. We're joined now by Sarah Jacques, Dr Sarah Jacques, a GP, and Dr Claire Ashley, who gives burnout, stress and career advice to people working in high-pressure jobs. Very good morning to both of you.
Good morning.
Sarah, maybe you could share with us a little bit of your story and what happened with you.
Of course. Thank you for asking me to come on. So I'm a GP of 17 years and have worked full-time all of my career. And probably for the last 10 years of my 17 years as a GP, the intensity of work has just been increasing and increasing. And probably for that length of time, I have been doing 50 to 60 hours a week, which would mean that I'm working on my day off, mean I'm working my weekends, means I'm working nights. And that intensity of work has just been increasing and increasing. The complexity of the work that we're dealing with has been increasing. The number of appointments, the number of patients we're having to see, all increasing. And it becomes very much a struggle to try and keep up with that demand and fill those gaps that we're expected to do without the resource or the support to do that.
And the effect on you was what?
The effect was that I began to feel that I wasn't delivering a safe service, a service that was sufficient, that was meeting the patient's needs. I felt that inadequate, really, and angry about the situation that I'm making all these sacrifices, but actually felt like I was achieving nothing.
Sarah, I mean, this is not easy to talk about. It's very brave of you to sit here and go through this with us. What do you want to share with us in terms of the point you reached?
I think for me, it wasn't, it was a sudden light bulb moment for me that I couldn't carry on like this. There was a trigger in that there was a near-miss accident for my family who were camping on a holiday without me because I was missing being with them because I was having to work again. And they were nearly hit by a car. Nothing, they weren't hurt, but it was a very near-miss thing. And it was this sudden realisation that I wasn't there. And then there was a realisation that I was never there. And it was kind of, what is the point of me sacrificing my time with my family, me, when I'm really not delivering anything on any level? So I felt that I wasn't being a good enough doctor, I wasn't being a good enough wife, I wasn't being a good enough mother. And it just always kind of, what is the point of what I'm doing?
You can really get a sense of how difficult it must have been for you, and it's clearly quite difficult to talk about now. So thank you for sharing that, Sarah. What has helped?
Stepping away, taking that time out. But that's quite a journey to start to feel better. I mean, it's been 2 years since I practiced now, and you have to go through many other emotions. Getting over that guilt that you feel like you've let down your patients, that you've let down your colleagues, that you've let down your family. And then there's the soul searching of, do I carry on and do medicine? And if I don't do medicine, who am I? For many doctors, that is our identity. Perhaps that's our failing, is that we identify too much with what we do. And we don't shut down. We don't really stop being a doctor when we go home. We can't close that door. We're constantly, we'll be thinking about, did we just make the right decision today? Did we get that right for that patient? It's always there on our minds. We can't shut that off. So, and of course, you're driving along, there's a car accident on the road, you're a doctor, you're meant to help. You can't switch off being a doctor. So I did have to struggle with what my identity was, and do I go through medicine and back to medicine, or do I find other things to do?
Let's bring in Dr Ashley. Everyone's listened to Sarah there, and we can hear how difficult that journey has been for her. How many other GPs, and I think particularly female GPs and physicians, struggle with the same things?
Yes, good morning, and thank you so much to Sarah for sharing her journey there. So yeah, it's a huge problem for GPs and for female physicians at the moment. So the recently published GMC annual workplace survey highlights how burnout and mental health problems is a huge problem for UK doctors presently. So overall, 33% of doctors said that they are struggling to cope with their workload at the moment, but this is 48% of GPs reporting problems with workload too, and working well beyond their rostered hours. And as a result, more than 1 in 5 respondents to this survey said that they were at high risk of burnout. And this is actually higher than during the COVID pandemic. We also know that 1 in 4 GPs know of a GP colleague that has died by suicide. And 84% of GPs currently report anxiety, stress, or depression associated with their job in the previous year.
Claire, we often expect and associate doctors with actually signposting patients to mental health support services. What is there for the GPs and doctors themselves who are going through this? Yeah, so there are a number of services that are available for GPs that are going through difficulties, so you can go to your own GP yourself. There's also NHS Practitioner Health, and this is a service that is designed specifically for doctors with mental health problems to refer themselves to. And there's also Doctors in Distress. I'm a charity ambassador for Doctors in Distress. They provide a range of interventions to support healthcare workers, so if you need support, do get in contact with them.
Yeah, Sarah, the figure that was mentioned, I was going to say statistic, but that's a meaningless phrase, isn't it? Number of GPs dying by suicide. I mean, I don't know, since you sort of gone public with what happened to you, have you had many people sort of sharing their stories along those lines?
Not me personally. I think there is still, especially with healthcare professionals, we don't consider ourselves to be human. Other people, and to admit that we're weak and that we're not strong enough is quite a hard thing to do. So I think people tend to hide it a lot and keep it to themselves.
Do you mean partly because you are in the medical profession?
Yes.
So to sort of diagnose yourself, as it were, is doubly hard?
Yes. Yeah. Well, it's the fact that sometimes because you're aware, there is perhaps in the profession there's still a bit of a stigma. We're expected to be very, very resilient, to a point where we're almost gaslit in that respect. That if we're feeling weak, that we're not coping, we're working long hours, we must be doing something wrong. And everyone is expecting something. We're all in. It's a very stressful job. We know that from the onset. We know that we're dealing with very emotive situations. We know we're managing an awful lot of risk. We understand that, but it's when you're suddenly finding you can't cope with that, but you feel it's just something that you feel you should be stronger. You feel you should be able to deal with that.
You know, I'm thinking, Dr. Ashley, there are parallels here with all sorts of other, well, just regular people, not just physicians, where maybe that first conversation, that first time you say to someone else that you're really struggling is possibly the hardest step. And maybe, as Sarah was saying, almost amplified within maybe a GP practice.
Yeah, absolutely. One of the hallmark things about that journey into burnout and any mental health crisis is it's very difficult to recognise what is happening to you when it's happening. And that's very difficult to deal with when you're a doctor, because you're dealing with so many patients who are going on the same journey. And if you had that patient sat in front of you in a room, you would be telling them to stop and to get help. But for doctors, it's very difficult to do that. And just to echo what Sarah said, I think there's a lot of stigma still within the medical profession about admitting that you have a mental health problem and getting that help. There's a lot of self-blame and guilt that stops doctors from firstly recognising that they need help, but also for asking for it when they need it, because we worry deeply that if we go off sick or admit that we're struggling, that our patients will suffer and that our colleagues will suffer from our absence as well. But also, we're not taught about how to manage stress properly. I think this is changing in medical curriculums, but, as certainly our generation of doctors, stress and burnout and how to manage your own mental health was never mentioned in medical school and postgraduate training. And so we actually have there is a lack of knowledge there about how to look after ourselves effectively. And being a GP is actually a very isolating job. We might work in surgeries, but we're autonomous practitioners and we tend to work in silos. It's far too easy when you're struggling and you need to get the work done to keep your door closed, to not take your breaks, to not spend time with your colleagues, which we know is protective against burnout and the development of mental health problems. And yes, obviously talking about other professions as well, there are lots of other professions where the workplace is very stressful and it's very easy to end up in this position as well.
Dr. Ashley, thank you very much for your time this morning. And Sarah, Dr. Jacques, thank you so much.
Thank you. Thank you.
Time is now